All right, so this is going to be part 1 for chapter 12, drugs for cardiovascular disease in your pharmacology for technician books. So your cardiovascular system is set up where it circulates blood throughout the body. It is bringing oxygen and nutrients that are needed to the tissues and carrying away carbon dioxide and byproducts that are being produced by your body. Your arteries will carry blood away from the heart and the tissues, and veins will carry the blood to the heart from the tissues. So your arteries are delivering oxygenated blood from the heart to the rest of your body, whereas your veins are carrying the carbon dioxide or deoxygenated blood back to the heart and lungs to be reoxygenated. Your capillaries are tiny blood vessels where critical fluid and gases and even nutrients are exchanged. So your heart, different terms that are associated with the heart, you have the sinoatrial node or the SA node. This is a group of specialized cells where a normal heartbeat starts. Depolarization is the flow of positively charged sodium and calcium ions into the cells, making the voltage positive. Repolarization is a flow of positively charged potassium ions out of the cells, which in turn makes the voltage negative. Your action potential is an electronic burst. When an action potential arrives at a myocardial cell, it will depolarize with an inflow of sodium and calcium and repolarizes with the outflow of potassium. So, causative factors of heart disease. We know heart disease is one of the leading cause of death in the United States. And so there's some different things that affect the risk for cardiovascular disease and actually lead to the cause of cardiovascular disease. So predetermined factors, meaning factors that we have no control over, which would be heredity, gender, and then increasing age. Factors that are influenced by lifestyle modification would be things that we can help control. So things like smoking cigarettes, having high blood pressure, making sure that you're taking medications to stabilize the blood pressure, high cholesterol levels, so taking medications or changing diet to help decrease the cholesterol levels, obesity and diabetes. So in terms of diabetes, if you're type 1, that is an irreversible form of diabetes. That means your body is producing little to zero insulin and you are now insulin dependent. But if you're type 2 or pre-diabetic, a lot of times that can be reversed out with diet and exercise and maintaining with some prescription medications. Angina. So angina pectoris is chest pain due to an imbalance between the oxygen supply and the oxygen demand. It does not cause irreversible damages or changes. Types of angina, you can have stable angina, unstable angina, and then variant angina. Symptoms and risk factors. So symptoms would include chest discomfort, sweating, dizziness, shortness of breath. Typically, it's often triggered by physical exercise, stress, or emotional stress. Risk factors, advanced age, coronary artery disease, hypertension, an increase of glucose levels, obesity, smoking, and type A personality. So type A personalities would be yours truly, always having the control, always worrying about things ahead of time, really not stressing ourselves out. So anti-anginal drugs, beta blockers. So beta blockers work by inhibiting the action of the catecholamines on the beta receptors. So it helps to decrease the heart rate. It helps to decrease the myocardial contractility and therefore will help decrease the blood pressure. Therapeutic uses of beta blockers, again, angina, arrhythmias, hypertension, myocardial infarction, which is heart attack, and heart failure. On slides 12, it gives you an example of what beta blockers are. One commonality that you'll see as they end in LOL and that is not laugh out loud, but that is a suffix in the name that can help trigger you to understand, oh, that's a beta blocker. Nitrates, so nitroglycerin is a nitrate. Nitrostat is what we use for patients that have angina. This is a very important medication. It's considered an emergency medication. Therefore, it must be put in a non-child-proof container. The nitrostat are small sublingual tablets, so they are dissolved under the tongue. They are very sensitive to light and air, so they must be kept in their original glass container. That container is then put into a prescription bottle. They only have a 6-month expiration date once the seal is broken on the container. And again, because the patients need to get to it in an emergent situation, they need to be placed in a non-child-proof container. The dosing of the nitrostat is they take a sublingual tablet. If they're not getting any relief from the tablet within 5 minutes, they should call 911. A maximum of 3 doses in 15 minutes. So the idea behind the nitrostat is it works extremely well for angina. So if they're having an anginal attack, that first dose within that first 5 minutes is going to work. If that dose is not working in that 5 minutes, you need to call 911 because that would be indicative of a heart attack. Calcium channel blockers, so amlodipine, diltiazem, nicardipine, nifedipine, these are all calcium channel blockers, so they prevent the calcium from entering into the cardiac muscle cells during the depolarization by blocking the slow channels, which helps to decrease the chest pain overall. Heart rhythm. So your SA nodes will generate normal cardiac rhythm at 70 to 80 beats per minute. An ectopic pacemaker is a pacemaker other than the SA node, so that is something that can be placed. Tachycardia is defined as excessively high heart rate, and one of the things that they use to determine that would be, the term just left my brain. They attach a bunch of, why can't I think of it? Okay, we'll come back to that. I can't think of what it is to save my life. I can see it. So basically it's a machine that is hooked up to you. They place a bunch of different little monitors on your heart, or on the outside of your chest, on this side of your chest, and then onto your back, and that actually checks the rhythm and the contractility of your heart, and it prints out a little sheet. And for the life of me, I cannot think of the term that they call it, so I apologize. So membrane stabilizing agents, these slow the movement of sodium into the myocardial cells, which reduces the ability to generate the action potential, and that is what sometimes causes the increase in chest pain. Potassium channel blockers are used for arrhythmias. So amiodarone is probably the most common IV that you're going to be making in the hospital if in terms of any cardiac issues, especially if they're cardiac arrhythmia issues. This medication can only be made into a hard normal saline bag. So there's different types of bags. This one is a different type of plastic that it must be put into because it does eat through the regular lining of plastic for the normal saline bags. Other agents. So again, we use beta blockers. We can use calcium channel blockers for arrhythmias. Atropine, digoxin, which is typically used in atrial fibrillation or flutter, and then isoprel. Heart failure is defined as a chronic progressive condition in which the heart is no longer able to pump enough oxygen-rich blood to meet the body's needs. So symptoms include shortness of breath, fatigue, edema, and exercise intolerance. The goals of therapy are to prolong survival, relief of the symptoms, improve the quality of life, and prevent the progression of the disease. Typically, the drug classes that we use for heart failure are ACE inhibitors, beta blockers, diuretics to get rid of the excess edema, and digoxin. So vasodilators are used to reduce the resistance against against how much the heart should actually work. It works really well. The isosorbide dinitrate is a vasodilator. One of the side effects is headaches and dizziness. ACE inhibitor, so you'll see a commonality in the suffix of the ACE inhibitors. So benazepril, captopril. So pril is that suffix of the name. That when you see that, that should be an indicator to you that it is an ACE inhibitor. They work really well for cardiovascular prevention of cardiovascular events, and are the typical go-to for the treatment of heart failure. Other agents, aldosterone antagonists, beta blockers, antiarrhythmic agents. So hypertension. So when we think about hypo and hyper, hypertension is an increase in blood pressure. Hypo is low blood pressure. So blood pressure is a product of cardiac output and total peripheral resistance. Your cardiac output is determined by three things: preload, afterload, and the contractility of the heart. Your systolic blood pressure is the pressure when your heart ejects the blood. Your diastolic pressure is when the heart relaxes and fills back up with blood. The blood pressure notation, you'll hear someone say systolic over diastolic pressure. So the systolic number will always be on top, whereas the diastolic number will be on the bottom of a blood pressure reading. When to treat. So typically a 120 over 60 to 80 is good blood pressure, is considered good. When you have patients that are over 60 years old and they have a blood pressure of 150 over 90 or higher, we should treat. Patients under 60, 140 over 90. Diabetics or kidney patients specifically, no matter what the age, is 140 over 90. So risk factors for hypertension: family history, cigarette smoking, because nicotine can increase the blood pressure, and a high-fat diet. Additional factors: if you have kidney disease, decreased pressure or delayed pulse in the lower extremities, obesity, because a heart has to work harder to pump the blood to those various areas, adrenal tumors, and then certain medications can actually increase blood pressure. So untreated hypertension or untreated high blood pressure can lead to cardiovascular disease, heart failure. It can lead to renal insufficiency or kidney insufficiency, accelerated cardiac and peripheral vascular disease. Therapy, so modifying certain lifestyle factors, using an additional drug if necessary, adding on a third agent. So sometimes patients that have high blood pressure take multiple prescriptions because of the difference in the way they work, and also usually add on a diuretic of some sort to help rid the body of excess fluid, which also can increase your blood pressure, because the more additional fluid that you have trying to pump through, the harder it is and the increase in the blood pressure happens. Myocardial infarction, also known as a heart attack. This occurs when the flow of oxygenated blood to a section of the heart is blocked. Causes of a heart attack are a narrowing of the lumen of one or more of the coronary arteries by 70% or more. That's typically caused by an increase in cholesterol, the plaque buildup. Risk factors: history of angina, alcohol consumption, reduced pulmonary vital capacity, cigarette smoking. So symptoms: chest pain or discomfort, upper body discomfort, shortness of breath. Other symptoms can include cold sweats, unusual fatigue, nausea and vomiting, lightheadedness, dizziness. Sometimes you'll get pain in one arm and not the other, and some people report jaw pain. Treatment. So the immediate goal of treatment is to open up the blocked arteries, control the pressure, and regulate the heart rhythm. So sometimes they're able to do that with stents, where they go in through the groin, the main artery in the groin, and put in what they call a stent, and it actually opens up the arteries. Sometimes there is so much blockage that they actually have to go in and do a bypass surgery. In a hospital terms, we call those cabbages. It doesn't sound very nice, but that's what we call open heart surgeries. Acute phase, again, oxygen, nitroglycerin, aspirin. Anytime you suspect someone is having a heart attack, you want to get them an 81 milligram tablet that is not enteric coated and have them chew that. That can help prevent further damage from the heart attack. Chronic therapies, anticoagulants, so blood thinners, antiplatelets, beta blockers, ACE inhibitors, and then of course medications that's going to help treat and control the cholesterol level. We are going to pause there for part 1.